A very good morning to all of you once again. So you have heard about the infections in ICU patient and then how to rehabilitate the cardiac patients. As a nurse, it's very important for you to know about how to manage a patient in intensive care unit. So it's always a challenge to treat a patient in intensive care unit. When you go into intensive care unit, you see patient is surrounded by so many machines, so many monitors, so many tubing. You are confused what to do and what to monitor and what is the outcome of what is the inference of that, all those monitors. So you need not be confused. Basically, what is important is the patient or the machines or the monitors. It's always the patient. And to monitor the patient, you should use all the other equipments what is existing. So first you should assess as soon as go into the ICU, you should assess the patient condition first. So you don't be panicky or afraid with the machine surrounding the patient. So being a nursing staff, before you go into the complicated things about the monitors and then what to monitor and what are the hemodynamics, I just want to briefly tell you about the basics, because once you understand this, you will understand the maintenance of the hemodynamics or how to monitor a patient in ICU. So heart usually pumps the blood forward through the vasculature. And the arteries, it carries the oxygenated blood from the heart to all the organs. And the capillaries are the micro vessels which allows at the organ level or at the tissue level the exchange of the gases or the exchange of the micronutrients as well as the removal of the waste products across the capillary membrane. And the veins, it carries the blood, deoxygenated blood from the tissues to the heart. And most of the time 70% of the blood is occupied in the veins. And blood constitutes 60% of the plasma, and the rest is the cell component. The cell component, basically it consists of the RBC, WBC and the platelets. Among the cell component, it is the RBC which constitute 90% of the cellular component. And it is the RBC which is most important in carrying the oxygen to the tissues. So it is very important to know about the pressures, the resistance, the flow, before you know about the hemodynamics, maintenance of the hemodynamics. So it's very important to monitor the hemodynamics of a patient in ICU. And when do you want to monitor all these things? These are the conditions where you monitor, particularly in patient the dehydration, the hemorrhage, GI bleed, burns, the surgery post-operatively, the acute MI, cardiomyopathies, or it can be shock because of any etiology, the septic or the cardiogenic shock or the neurogenic shock, anaphylactic shock. There is a shock, then again you have to monitor the hemodynamics of the patient, and then the congestive heart failure. So these are the few conditions where you need to monitor the hemodynamics of a patient in an ICU. So as I said, you should know about the pressure, the flow and the resistance, because these are the three which determines ultimately the tissue oxygen or whatever the hemodynamics. The pressure is the force exerted, okay? And the blood flow is the amount of fluid moving across a unit time or the length. The resistance is the opposition force which prevents the blood flow or to the organ tissues or the organs. So when you're talking about the cardiac cycle, it consists of a systole and the diastole. So when the atrial and ventricle are filling phase, it's called a diastole, and the contraction phase is called as a systole. And during the diastole, the left and the right ventricles receive the blood from the atria, and during the systole, the blood is squeezed into the arteries. And what is preload? These are the factors which determine the hemodynamics, and you should know all these things, and we should also know where to intervene, when to intervene, and what parameters to be taken into account. So these are the things you should know before you monitor the hemodynamics of a patient. So preload is a left ventricular and diastolic volume, okay? And the afterload is the pressure, the resistance of the blood flow out of the ventricle. So if the arterial BP is high, the left ventricle must exert more forcefully. We should pump the blood more forcefully against that resistance. And what are the goals of this hemodynamic monitoring? Basically, it is to have a good organ perfusion or the tissue perfusion. tissue oxygenation. That is the main goal. Should maintain the tissue oxygenation. And this monitoring is to basically, because of in patients who are very critically ill and sick, this tissue oxygenation is compromised. That's why you should detect early when there is an inadequate tissue perfusion, and you should titrate according to the hemodynamic targets, and you should monitor all these things, and you should achieve those targets. And to differentiate among the various organ system dysfunctions. So when there is a tissue perfusion is lacking, they go into a dysfunction, and they ultimately land up in multi-organ dysfunction. So these are things you should monitor. The blood pressure monitoring, usually it is done through a cuff, BP cuff in a normal patient. But when it comes to intensive care patient, you should do it invasively. Invasive monitoring is required because it is more accurate, and then it is continuous monitoring. And what are the other things we monitor? The arterial line, we should have an arterial line in place. We should measure the central venous pressure. We should also measure the pulmonary arterial pressure, the pulmonary capillary wedge pressure, and the cardiac output. We should also monitor the mixed venous oxygen saturation. These are things we should monitor in an intensive care patient. Okay, you should secure the arterial line as soon as possible. You assess the patient clinically, and then you should secure the arterial line. Okay, it is important for you to learn, because when you go to the Western world, it is the nursing staff, the ICU staff, which takes care of everything, the maintenance of the arterial, securing the arterial line, monitoring all the pressures, whereas across the arteries, whatever the central venous pressure, and they should also take decision depending upon the parameters. Okay, so you should be well versed. When you want to be an ICU nurse, you should be well versed to secure the arterial line and to monitor all these things. So it is also useful to monitor the ABG or the lab parameters continuously, particularly in a patient who is hypotension, where you cannot secure the blood samplings repeatedly. So it is important to have this arterial line. So it can be placed at the radial artery, the femoral artery, or the brachial artery. Okay, it should be connected to a pressure source, and you should also know about the complications. You can't just blindly put. You should know about the complication before you are doing any procedure. So it can end up in the thrombosis. It can end up in embolization, the blood loss, because the skeletal line is there for a longer time. It can have infection. That's the reason why you should change the tubings in the transducer every 96 hours. So as a nurse, you should take care of all these things. You prevent or reduce the potential for the complication while you are placing. Think about the complication, and you place the central line carefully, the arterial line carefully. To maintain 300 millimeters of mercury as a pressure source, and maintain a continuous flow. There should be continuous flow. Once you stop, then they land up in complications. There should be continuous flow should be maintained. And the dressing, you should take care of the dressing, should be changed repeatedly. And whenever you are opening the caps, it should be sterilized. Okay, and then recapped. And you should change the tubings every 96 hours. And if you are removing the line, you should put pressure for at least 5 minutes. Okay, it also allows us to measure the pressures, okay, arterial pressures. So the peak of the wave, it's called as the systolic pressure, okay, and it determines the left ventricular function. And the lowest point of this wave pattern is the diastolic pressure, and it tells you about the peripheral resistance against which the heart has to pump the blood, and normally it is 60 to 90. The systolic pressure is 100 to 130, and the diastolic pressure is 60 to 90. Okay, there is also a diastolic notch. You should also know about the wave pattern. The diastolic notch at the downstroke, it actually reflects the aortic closure, and it delineates between the systolic and diastolic function of the ventricle, right? So you should also measure the mean arterial pressure. The mean arterial pressure, it is nothing but it is a calculated one, pressure that closely estimates the perfusion pressure in the aorta and its branches. Usually it is the average systemic arterial pressure during the entire cardiac cycle. During systole, we have a BP of 100 to 130, and during diastolic we have 70 to 100. So this is the average which is there throughout the cardiac cycle. Okay, 2 minutes more, right? So you should assess the mean arterial pressure, should be 70 to 100. Okay, and then the next thing is the central venous pressure, right? It gives us the information of the pressure in the right atrium, right? And there are two methods of measuring, the manometric measure and pressure transducer. The water manometry, probably you might have been seen, but initially during my PG days we used to do this. You should connect a small tubing to the central line and a source of water. or you should actually fill that column with a water source first, and then you should close the water source. The column adjusts itself to the pressure is equivalent to the pressure of the central venous pressure. So that's how you used to do this before. This is the simplest and very easiest method. But anyhow, you should take care of the level of this manometry should be at the level of the heart. This is how you measure. Okay. This other method is the pressure transducer. This is more accurate and it gives a wave pattern. There are different wave patterns. You should know about all this wave pattern and each wave, what is the significance of each wave. So we have this, just go through about this because a lot of lack of time, just go through. If there's a wave pattern, you should be able to know the wave patterns and what are the abnormal wave patterns. Okay, we can also have a respiratory variations in the CVP. Okay, the next thing is the pulmonary capillary wedge pressure. This is also important because it gives us the pressure at the pulmonary capillaries, the left atrium and the left ventricle. And during the diastole, when this mitral valve is open, it also gives the pressures at the left ventricle. So these pressures we can know, and then we can know what are the underlying diseases, and we can target these values. And these are the few indications where you should look into the pulmonary arterial pressure, the pulmonary capillary wedge pressures, and all those things. Just go through this. And how can we measure all these things? With the help of a catheter, Swansgen's catheter, and it has got 4 parts. One part is to inflate the bulb, and second is to assess the central venous pressure. The third is to measure the cardiac volume, and the fourth is to measure the pulmonary arterial pressure and the pulmonary capillary wedge pressure. Okay, and these are the different wave patterns at different levels of the heart. The first was the right atrium, then the right ventricle, then the pulmonary artery, then the pulmonary artery wedge pressure. This is the wave pattern we get while passing through the different areas of the heart. Okay, this is the same wave pattern. Okay, and again it has also complications. You should be very careful in placing these catheters. These are the complications, right? And the monitoring is the respiratory monitoring, that is the ABG. And then you should assess also the ventilatory parameters. So all these things should be done when you are doing a parameter. Apart from that, you should also focus on the individual organ parameters monitor. For example, kidney, you can monitor through the urine output. The urine output should be maintained at 1 ml per kg per minute. You can assess the neurological status by GCS score. So all these things you should be monitoring, and you should have the target should be it should be depending upon the individual parameters. There are no the common goals. They are tailored according to the patient requirement and underlying condition and what parameters are abnormal. So to become a good nurse or a good nursing care, you should always have this. You should become a good intensive care nurse.